All right, good morning, and thank you for joining us today for today's Lunch and Learn, presented by Dr. Heidi Rula, our Integrative Oncologist.
I'm Heidi Rula. I am the Integrative Oncologist and Director of Supportive Care Services here at Ironwood Cancer Centers. And today I'm going to do part 2 of our female sexual health and intimacy talk for the cancer survivor. This is about really kind of reestablishing your sex life after cancer. And, in part 1, we really kind of talked about this whole concept of sexual dysfunction and then kind of did more of a deep dive on how to address pain issues related to sexual function. So today is more about kind of, okay, how do we kind of get restarted in being sexual, maybe after having taken a pause during treatment, and how to kind of address some of the issues that come around with kind of, returning to being sexually active. So let me just kind of move forward here. I think most cancer patients do put their sex life on hold while they're in treatment. Again, a number obviously continue to be sexually active depending on the type of treatments that they had to, go through for their cancer. But for many, when you get the diagnosis, you kind of go into crisis management mode. You feel pretty poorly from all the different treatments that you have to receive to address your cancer. And so really it's not until, all of those things have kind of, finished where you can start to think about, okay, I would like to kind of restore that part of my life. It's about kind of, again, trying to find normalcy again, post-treatment, and, restoring your sex life is part of that return to normalcy. In our last talk, we talked about that a majority of cancer survivors report some type of sexual dysfunction. So, estimated somewhere between 50 and 100%, but only 20% of those cancer survivors who are having difficulty actually go to seek any help. So there are a lot of people, a lot of cancer survivors out there who are struggling with some type of sexual function issue that really kind of never goes addressed. Why is that? Certainly I think everybody has varying levels of comfort, talking about sex, whether, you as an individual have a difficult time, or you get a perception from the provider that you're working with that they're not completely comfortable with. So sometimes it's, confusing as where you're going to go to kind of get help. Who do you talk to, for these things? And so that can be a barrier for people to be able to get the help that they need. And it also, again, sometimes it really depends on your level of comfort in your relationship with your intimate partner. Again, some couples, talk very openly about sex with each other, and for others, it's just a very uncomfortable conversation. And so sometimes if that conversation doesn't occur, problems can kind of persist, in that area of sexual function, and really kind of have struggles with a sex life for years. So it's not something that, you just want to ignore because, again, I think time isn't always going to heal issues with kind of normalcy kind of in your sex life. So here are just a few myths around cancer. Again, I think we just kind of addressed on this. Some people feel like, sex will just spontaneously, get back to normal after some period of time. We'll fall into a groove and everything will be okay. Well, we kind of just talked about how that probably is not going to happen for a lot of individuals. For some, things will, start to resolve and it might work, but there's certainly a large number of cancer survivors where kind of it doesn't really kind of fall back into something that is satisfying for them as a couple. And the other kind of myth I think out there is that different isn't good. It doesn't mean it is no longer going to be good, that your sex life isn't going to be satisfying. Because it's just certainly, cancer can change a lot about how you go about being intimate with your partner. Different, surgeries can kind of change what works for you. Whether, it's a colostomy bag or mastectomies where you don't feel comfortable incorporating that, or things like that. There's a lot of things that might be different. the vagina might work differently, might have issues with dryness and some other changes that now you may have to kind of address in a different way in order to be able to have arousal and to have a satisfying sexual experience. And so there's concern that these things mean that you never are going to be having a satisfying sex life again. But I think when they look at surveys of couples out there, women who've undergone different procedures like mastectomies and things, whether or not you had a mastectomy or a lumpectomy, we're really seeing pretty much equal levels of kind of sexual satisfaction. So again, the loss of some of these things really don't preclude you from having a satisfying sexual experience with your intimate partner. So those are a couple of the myths. So just kind of to review, last time we talked about this concept: what is sexual dysfunction? Really kind of any problem that can prevent, an individual or a couple from having a satisfying sexual experience. So we did the deep dive last time on, the pain component of sexual dysfunction, how to address pain. So, if you didn't or didn't join us for that segment, we will be kind of posting that on our Ironwood YouTube channel so that you can be able to kind of go back and watch that if you have any interest. But today we're going to really kind of talk about some of the other areas. So desire is a big area, and so we're going to talk about kind of low libido, lack of desire, kind of issues with arousal, issues with achieving orgasm. Again, those are some components of sexual function that can lead, to kind of this concept of sexual dysfunction. So we'll kind of dive into those areas today. Again, the biggest thing that I see, when I work with patients who are having issues, with sexual function, is really kind of the libido issue. It's very common for women to come in and say, really, I just have no interest. I could, take it or leave it, but I feel bad about my partner. So I have some interest in trying to, kind of restore this because I miss this in our relationship. But, again, there's nothing driving me to want to have sex or have some type of intimate experience with my partner. And so really when we talk about, again, looking at this low libido issue, we have to really kind of understand that it's not just one component. There's many different variables that go into what a individual's sex drive is like. And so, we can kind of divide some of those issues into medical issues. Certainly, many women are put into menopause from chemotherapy or different hormonal therapies, which can then impact sexual function. Surgeries can impact, the genitals. It can have pain issues around that, which again, we talked about some in our first segment. Medicines can play a role, hormone changes can play a role, and then there's many cancer survivors who have persistent fatigue after their treatment. So certainly if you're tired, that can play a role into your interest in sex. And then kind of diving into this whole other kind of the psychological or the psychosocial component of why maybe you have a loss of sex drive, change in your body image, and lots of things, surgeries and things like that can alter your body and your confidence in your body. So that might be, something that's driving your lack of interest. Your relationship may have changed, due to your cancer diagnosis, or maybe some pre-existing issues, going into your diagnosis were there, and maybe they were even compounded by, just the stress of going through your treatment, whether it be financial or just kind of dynamics in your relationship that kind of set up there to be some more struggles. Again, if you're having some issues in your relationship, it's going to be hard for you to want to kind of connect with that on such an intimate level. Maybe some resentment or what have you in terms of feelings for your partner. Stress is a big thing. Or distress, and as well as kind of mood changes. So anxiety and depression can play a role. So kind of asking the question, why, looking at kind of what's going on in your life and seeing, kind of are any of these areas maybe, an issue for you? If they are, then kind of trying to go at those issues and seeing, if we can kind of address that, will that kind of open up and improve libido? for women, we say kind of this Venus versus Mars issue. What really kind of would be considered to be sexually satisfying for a woman versus for a man. For a woman, sexual satisfaction is more linked to kind of just happiness in a relationship. You're going to be more satisfied if you feel like you have a very strong, solid relationship and connection with your partner. Men, a lot of times their sexual satisfaction is related to frequency of sexual activity and the ability to have a good erection. So women, it's very much about kind of feeling connected to our partner and understanding that's a super important part of sexual satisfaction. When we look at some of the medical issues, medications, can be at play with, both libido and ability to have an orgasm. Lots of different medications are used throughout treatment, narcotics for pain issues, both during treatment, sometimes after treatment, if you have some continued pain, neuropathy or some other kind of pain from, surgical procedures or such, that might cause you to kind of have to be on some narcotics. Now, obviously, narcotics are depressants to your nervous system and therefore can impact, libido and even orgasmic function. Mood, drugs, so a lot of cancer survivors are on, various depression and anxiety medications, sometimes just for maybe dealing with menopausal symptoms, maybe not for depression themselves, but we use a lot of these meds for some of the menopausal symptoms. And so, some of the common ones are, we call them SSRIs, so Paxil, Prozac, and Zoloft. Those are notorious for causing issues with ability to have an orgasm. And also, different sedative drugs like, Valium type category things, again, can play a role in libido. Frequently used, Zoloft are used during pregnancy. Around these that again function, which might play a role in sexual function. And there's a lot of different blood pressure medications, that can affect, orgasm, that can affect as well as sex drive. So again, a lot of these are just kind of some of the most common ones, but there's a lot of other ones that might be in play. Again, looking at kind of medication lists and seeing, if there's maybe something on the list that might be interfering with achieving some type of kind of satisfying sexual experience for the individual. So many of my patients come in and feel like it's their hormones that, really have kind of, gave them, a low libido. But when we look at kind of the literature about the role of hormones, estrogen and progesterone are really thought not to have a significant influence on the sex drive. So obviously, especially if you had a hormone positive cancer or you went into menopause from chemotherapy, hormones, are changed significantly on these medications, and so you get put into a very low estrogen state. But it's really not that estrogen that we feel is kind of driving libido, so that really shouldn't be that component. Testosterone, can play a very small role, in sex drive. Again, usually, testosterone isn't something that we're blocking with any of our medications, and so low levels of testosterone usually are all a woman needs to be able to have a reasonable sex drive. Sometimes, again, if a woman has a hormone negative cancer, sometimes looking at testosterone levels might be helpful. I mean, if they're very low, sometimes looking at ways to kind of boost up testosterone levels and trying some type of topical cream. Generally for testosterone, we don't replace testosterone orally because it can have an impact on the liver and create liver tumors, but we have done testosterone replacement in terms of some type of topical creams for replacement, or some women have gone on like testosterone pellets, which is generally a very high dose way to kind of deliver testosterone. So I tend to be, if there's going to be a replacement, of more of a fan of using creams, which can kind of keep the dosing on the lower side. But anyway, sometimes looking at testosterone, that might be a way to address it, but it certainly isn't, the kind of end all to kind of resolving libido issues. It's a very small component, and certainly over my career, I've had different women go on testosterone replacement, and a lot of them, report back that the testosterone really didn't improve their libido. It just made them more angry, more aggressive, in a way that they didn't like. So it certainly isn't going to be, something that's going to fix everything. So looking at other issues, I think, is important when we're trying to figure out why, a woman might not have any significant sex drive. So again, I think, medical issues need to be looked at. Are there components going on the medical side? But a lot of times, there's a lot of psychosocial issues going on that are impacting the sex drive. What's going on in the relationship, what's going on with your body image, what's going on with your mood. Those are some good questions to ask to see whether or not you think there's any kind of areas that really might be holding up your libido from being something that you would feel is satisfying for you. We know that the libido we talked about it has so many factors to it. Emotions. Just a woman's comfort with being able to incorporate some sexual fantasy as a way to kind of help boost her libido. Whether or not a woman feels sexually attractive, again, after sometimes all the changes that occur to the body, after cancer treatments, it can be a struggle for a woman to feel feminine, to feel sexual again, and so that can play a role in desire. And we said, testosterone levels. So all of those are kind of things to think about, when we talk about maybe the sex has been paused for a while. Helped out with kind of getting you to your appointments and helping you when you're sick and getting all your medications. And, I think you could start assuming different roles in the relationship where your partner may all of a sudden become your caretaker. You're the patient, he's the caretaker. And in that dynamic, it doesn't really create, a place where you might feel like lovers again. And so I think some of the work on trying to, return to kind of normal sexual activity in your relationship, or a satisfying sexual activity in your relationship, is about, trying to reset that when your treatment is done, and almost kind of having, a conversation, with your partner to say, what, you're really awesome, helping me through my treatment. But now, I feel like I'm well enough. I don't really need you to kind of take care of me anymore, but I really need you to, to be there as my partner. And I really kind of want to get back to that role where we are intimate with each other, and again, you don't have to see me as someone to take care of. And sometimes that conversation can just be had kind of naturally with your partner, and people feel comfortable having that conversation and navigating how to kind of make that role change. And other times it really would benefit to incorporate some type of counseling. Couples counseling can be very helpful, or even individual counseling, but there's a lot of good data in sexual health and the cancer survivor that couples counseling can really help in a relationship, addressing some of the relationship issues that might be preventing a couple from having kind of a satisfying sex life. One of the big issues, obviously, after cancer is body image, which we touched on a little bit. But cancer can do so many different things to the body. I mean, whether or not you came in with a positive body image, before your cancer treatment. Many women, again, patients said, I had great hair, I had great breasts, and now, they're both gone. And these were things that I felt good about myself for. And so sometimes, again, you have a good body image going in. Sometimes your body image wasn't so positive even before your diagnosis. And now all of a sudden, again, you've lost your hair. You've had surgical changes to your breasts. Again, maybe you've lost sensation in areas that generally were gratifying to you as part of your being intimate. And so all those are gone. And so sometimes returning to feeling like a sexual being, feeling womanly, after these changes can be a challenge. And so I think a lot of patients are concerned that with all these challenges or all these changes in my body that I'm no longer attractive to my partner. But I think when we look at some of the research out there, what we find is most partners are really kind of report that they're less concerned about the physical changes that their partners are going to go through. I think the patients themselves, women themselves, are very concerned that their partner isn't going to find them attractive. But I think the partner is more just worried about just their health and not so much about whether or not these body changes are going to impact their sex life. So I think sometimes a way to kind of frame that for a woman is to kind of think about if your partner was going through something, if he was going through a surgery that altered his appearance in any way, would you still find them attractive? And really kind of using that same paradigm for kind of having how your partner might look at you, understanding that there are issues that connect you to a partner that go way beyond the physical, and that cancer can't take those away from you. So I think when we work on helping a woman return to feeling good about her body, and coming to that place of acceptance. I mean, again, it's a process, and I think one of the things that we start with is just acknowledging that all feelings you have about your body are valid. Some women say, it's so trivial, I shouldn't be worried about my hair doesn't look as good as it did before. I shouldn't be worried about my breasts, are misshaped, or one is different than the other, or I have this little dent here that I didn't before, and I want to get it fixed, or my face is dry. Again, I think, it's okay. Yeah, they'll say, you've been through a really tough experience. If there's some things that you think that you can do that, are going to help you feel better about yourself, it's a very valid, I think, effort to put in. You certainly can, if it feels like it might help you feel a little bit better about yourself, then I encourage women, go pursue it. If you want to talk to the plastic surgeon, can they make your breasts look any better? Do you want to have, do you want to have a facial done? Do you want to have something done that's going to make you feel good about yourself? Certainly, all these things that can help you kind of return to feeling positive, these can be some things that, again, can be healing for you. So it's really, I think nothing's too trivial. Again, I think, it's really about kind of honoring kind of what your concerns are, saying that they're valid, and kind of doing what you can to help that. I think the other piece is just understanding that there's grief, when your body has gone through changes, having grief over kind of the loss of your breast, the loss of a certain function in your body. Again, sometimes women have colostomies and things like that. Their body starts changing, and again, there's going to be some sadness that goes into that. And kind of working through that grief so that you can get to the other side of, just accepting kind of where this cancer has kind of taken you to, but it is a process. It does not just kind of happen overnight. And so allowing grief to kind of, be processed is a healthy part of kind of, again, working through this experience to get back to feeling more like yourself. I think, just being compassionate to yourself, and kind of focusing on some of the positive things that make you, a wonderful person, that we're much more than, our breasts or, a vagina that's working, optimally. I think, again, there's so many other things that make us, a wonderful person. What are the things that you do find positive in yourself, focusing on those attributes, things that cancer did not steal from you, are still present and still make you, a beautiful human being. And I think just kind of sometimes being mindful of the thoughts that come into your head. I think having negative thoughts, I look terrible. Who would want to look at me like this? Catching those things, and I think in some ways, really kind of being, your own reviewer to say, would I ever say that to somebody else? To myself. Why more compassion, more grace, and then being such a critic to myself. Also, sometimes looking at journaling, kind of again, writing some positive attributes and some things that you have gratitude for in a journal can really start helping you focus on all the things that you still have that cancer did not take from you. You're also seeing that taking care of your body is another way to kind of help with body image. It goes beyond just what the exercise does in terms of weight loss or tone or such, but just kind of engaging in exercise has been shown to improve libido, improve body image. So kind of again taking the effort and making it a priority to kind of have good self-care with eating good foods and exercising can really be a boost to yourself. So kind of finding those things, if you're really struggling with body image, then sometimes working with a counselor to really kind of help put those things in play for yourself, and if you're finding it's difficult for you to do that on your own, working with a professional like one of our social work counselors here at Ironwood can be something that can kind of help you kind of get to that place of acceptance and self-love. The other thing we talked about is how mood, and fatigue can impact sex drive. So if you're down and blue, nothing in life feels, interesting, or you didn't really, again, have no, if you have difficulty being able to kind of get up and do some of the basics of your day, sex is probably not going to be at the top of your list. And so, definitely, that depression can play a role in suppressing, one's sex drive. Anxiety as well, as your body is just kind of in this kind of hyper vigilant, kind of anxious state. It's really not going to allow the sexual part of the brain to be activated. So, addressing then, the mood, as the first way to address libido, because again, I think to get at a healthy libido, you have to get at kind of feeling good from a mental health standpoint to start with. Fatigue is also kind of another issue that can come play when you're tired all the time. Again, you're too exhausted, for that sexual part of your brain to kind of be turned on and want to be engaged. So looking at kind of working with your medical team to see if you can address whether it be mood or energy to be able to, again, start working on a healthier sex life. So arousal can also be another component, of sexual dysfunction. So a lot of times people say, well, I have interest, I'm fine with being sexual, but I feel nothing. My breasts used to be, a place where I could get turned on, or sometimes my partner could just look at me and I would be turned on, and now it's just I feel nothing. So certainly sometimes working on how to kind of restore ability to be aroused can be an important part of getting the whole sexual function kind of back into play. One thing we can say is that for arousal, sex generally does not affect the mind. And so in that, your mind is really kind of one of the most important areas for arousal. So that is still intact. So really kind of tapping into the mind is a way to help with arousal versus just, working on stimulation of a body part. Again, I think that can be an avenue to really kind of correct issues with arousal, but it will take some effort to kind of work on how to kind of engage the mind in being aroused. I think there's a lot of different research out there looking at what might help, and some interesting things that have come out is really some of these mindfulness-based therapies. Really, mindfulness is really about being completely present in the moment, kind of, being relaxed, kind of, letting go of distractions around you. So you can kind of imagine that if you were relaxed and, and felt, de-stressed and, didn't feel distracted, that really might help your desire. For mind is just kind of engaged in worry and our thoughts are somewhere else. It's very hard really to enjoy, your acts of intimacy. So again, looking at these programs that use mindfulness, obviously there's different therapists that will, like sex therapists, that will utilize mindfulness-based programs to help cancer patients with to improve their ability. There's lots of kind of self-help things out there that have been shown to be helpful. Different apps out there. Furley is one that works on, again, just kind of arousing the mind, and getting to that place, so turning on the sexual side of your brain. Headspace, actually one of the common apps out there that we use for meditations, has a mindful sex component to it that can be helpful. But it's really about, again, trying to engage the mind and being fully present to all the sensations in the body that can really kind of stoke the sexual brain. I mean, I really think, that you can turn the sexual brain off when you're under stress and you're going through treatment. And sometimes it really takes some work to kind of get that part of your brain working again. And that can certainly, be beneficial at restoring some normalcy back in the sex life. We talked about how exercise sometimes can be helpful for kind of improving body image and sometimes even just sexual function. And one of the exercise therapies that has some research behind it is yoga. Yoga, just regular yoga, has been shown to be beneficial for both arousal and orgasm issues. So again, really looking at maybe just some physical aspects, can you be exercising, can you be taking care of your body more, and then how can you engage your mind? So yeah, I think those are things to kind of consider. Let me kind of move on to this one here. So some other strategies besides mindfulness to think about if you're having issues with arousal. Again, sometimes, you have loss of sensation in the breasts and the genitals that really kind of helped with arousal before, and it might not be, working as well. So sometimes, using stronger things for stimulation, like vibrators, have been shown to be helpful. A lot of times vibrators, using it kind of around the clitoris, can help give you a little more stronger, stimulation that can help with arousal. And then also just kind of the exploration, the breasts, and the genitals are only one area, for arousal, but there's certainly other erogenous zones. And so sometimes, again, just taking the time with your partner to learn, what stimulates you, what turns you on, can be, a way to kind of find kind of a new normal within, your sex life. Again, erotic stories, sometimes watching movies together, things like that. Again, you're trying to kind of stoke your sexual brain, get it turned on. It's been turned off, we got to turn it back on. So again, there's different ways to do that. Again, whether it's mindfulness or again, whether it's kind of, again, sometimes reading romantic novels or things like that, that might help kind of, again, get the brain into more of a sexual state. Sometimes, again, working in that world of fantasy or journaling, sharing that with your partner if you have comfort with that, has been shown to be helpful. Or just really kind of setting the stage, sometimes just setting a date, with your partner to be intimate, and really kind of, again, have it being just a very about kind of connection, kind of creating a mood that's romantic, can really kind of facilitate maybe these feelings of wanting to be sexual with your partner. Orgasm can sometimes be an issue, but in general, cancer therapies aren't going to directly impact a woman's ability to have orgasm. Even with some surgeries, sometimes, women have had to have, laser or radiation to the vagina, or things like that might, impact, how the genitals work. But they've found that you can still use other areas of stimulation where a woman is able to achieve orgasm. So it not necessarily see that it's really kind of that cancer treatments have taken away the ability to orgasm. I think, again, when you're having difficulty with orgasm, really think about medication. Are you worried about how you look or and maybe that's kind of playing a role in your ability to have an orgasm. And I think, really is also to look at this myth that If your sex does not result in an orgasm, then it's not satisfying. We know, again, from all the research that that's not true, that there's can be significant satisfaction with your sex life, even if you never achieve orgasm. That, again, it brings that feeling of connection with your partner. And so sometimes, taking the goal of kind of achieving orgasm off the table and saying, we're just really about kind of just feeling good and connecting with you. And if an orgasm happens, great. But if it doesn't, that doesn't mean that this wasn't a very kind of satisfying experience between a couple. And so sometimes when you kind of, again, take orgasm out of the equation and just kind of, again, really kind of feel in the moment, that sometimes it becomes easier to orgasm. And even if you don't, again, still feeling connected with your partner. So kind of medically, you've kind of gone through, all these psychosocial, other medical, issues, and you're still feeling that, those aren't really kind of your areas, and you're still having issues with libido. Obviously, there's a lot of different things out on the market trying to help the female libido, the female orgasm. I can say from a pharmaceutical drug standpoint, those are all pretty disappointing. I think one of the more common ones out there are Addyi, which is for a premenopausal woman only, and is something you have to take every day. And studies have shown that it slightly improves a woman's libido. So not very encouraging to have to take something every day, have some side effects, only get a slight improvement in libido. It says, I think somewhere around 50% or less of people who took Addyi actually had a positive effect from it. So anyway, that certainly, looking at medicines, Vyleesi is another one. It's injectable, so again, you have to use that 45 minutes before sex. So, having to inject something in you before sex and kind of wait for that to kick in isn't always, the ideal situation. Viagra, has not been approved by the FDA for use in women, but there has been some off-label use for helping a woman achieve orgasm, improving arousal and vaginal moisture with sexual activity, but does not really kind of cover the libido, doesn't really impact libido. So those are some of the drugs out on the market that are being used for sexual dysfunction issues in women. Lots of different supplements out there on the market for libido. Again, I think none of them are overwhelmingly helpful. Again, there's studies on, it's very small scale studies on them. Most of them, again, you have to take them daily. There can be drug interactions with any of these herbs. You got to be careful and make sure you check with your physician or healthcare provider to make sure that it's safe to combine it with whatever other therapies you're taking. But tribulus, again, can be helpful for libido in some small studies. Maca, a lot of women use maca for libido and menopausal symptoms. Some small studies shows that it improves menopause, as well as some of the antidepressant effects. So again, we talked about a lot of times some of these antidepressants can cause issues with orgasm. Maca has been shown maybe to kind of counteract some of that. It's not really well known whether or not it binds to estrogen receptors, so there is some concern for women who have hormone positive cancers. You would have to take it daily. 1,500 to 3,000 milligrams daily is the dose of maca. Another herb that you might see in some of these libido supplements, there's something called horny goat weed. This is a Chinese herb used to treat sexual dysfunction and fatigue. Again, most of this stuff has very kind of limited data on it, might impact testosterone and might have estrogenic properties, might affect heart rhythm. So some potential issues with it. And there's potential, drug interactions if you're on aromatase inhibitors, which are, the common medications, kind of the common hormone blockers that are used for hormone positive cancers and in a postmenopausal woman. And then some other things that are looked at, L-arginine, an amino acid that can increase blood flow to areas. So, sometimes, it's been shown to help with libido, but you have to take it daily. sometimes going to upset your stomach or cause some headaches if you take it. Ginseng has been looked at being have fatigue. Again, you have to you guys there? My screen just went out. So hold on a second. Okay. Sure. I don't know why my screen, hopefully everybody can still hear me, but yeah, so again, I'm just kind of going over these ginseng, arousal creams, so you can apply them topically, increase blood flow to the clitoris, maybe increase clitoral sensitivity. You apply it, before sexual activity. So sometimes that can help with arousal. Some different kind of blended herbs out there. There's one by Bonafide called Ristella. That's a combination of different herbs that has shown on, again, small scale, kind of more proprietary studies that it might help with libido, sexual function. And again, some of these combos like Argin Max and Gaia has a women's libido one. Again, some small scale, reports that it might be helpful, but nothing that's overwhelmingly helpful for libido. So anyway, just to kind of give you an overview, when you're having issues about kind of returning, how to kind of go about returning to, reestablishing a sex life with your partner. A lot of it is about just kind of reprogramming kind of that mind-body connection, being comfortable with your body, having conversations, with your partner, kind of really looking to explore kind of what works now with your new body in terms of, sexual function, arousal, that type of stuff. Sometimes, doing some of the psychological work, and working with counseling to address kind of body image, which can really kind of be a significant problem for women in being intimate. So sometimes getting help with that might be important. Connecting with your healthcare team, generally, the medical oncologist, might be able to direct you, and so letting your medical oncologist know about it. If you have your gynecologist, a lot of times they can work on some different things that might help with vaginal, health. And again, here at Ironwood, I work with a lot of our patients on kind of all aspects of sexual dysfunction. And then again, if none of these things seem to be working for you, working with a counselor, has a certification in sex therapy, can work sometimes either individually or in couples therapies to be able to achieve kind of a healthy sex life. So anyway, that is really kind of the end of our talk here. I'm going to turn it over to question and answer. These are some resources that, that you might find helpful kind of in trying to kind of find ways to kind of address any issues that you have. And so I'm going to go ahead and open it up to turn off my screen and open it up to question and answer there. So.
Okay, Dr. Rula, it looks like we have a couple questions, and then I am also going to open it up to the members that are watching here. The first one would be, should I attempt intercourse even if I do not have a strong libido?
Yeah, again, I think, that during cancer treatment, and I just talked a lot about how kind of the sexual part of the brain it gets turned off. It really gets focused on all other aspects. Kind of you're in kind of that fight or flight mode. Your body's just kind of working on survival. So we really kind of suppress their sexual self. And so sometimes the way to kind of get the sexual part of your brain turned back on is to really kind of start engaging again and being sexual. Kind of having those intimate moments, setting up maybe a date where you can be intimate with your partner. Maybe it doesn't have to culminate into actual sexual intercourse, but maybe it's just touching, hugging, feeling pleasurable, just to kind of explore it. I think again, all these things will work to kind of stoke kind of the fires of your sexual brain.
Okay, thank you. And who on my healthcare team should I go to regarding my sexual health after cancer?
Yeah, I mean, again, I think it's good to start maybe the conversation with your oncologist. But a lot of times a woman might have a gynecologist just to work on, issues with, if they're vaginal issues, vaginal dryness. A lot of times your gynecologist can come up with different treatments and obviously make sure that there's nothing else of concern, causing any type of pain, with sex. But I think it's certainly the gynecologist can play a role in that as well. As I said here, I work with many patients here at Ironwood who are having issues with kind of returning back to being sexual, and so can have certainly referrals into myself, and can also be a resource for our patients.
All right, thank you. Do we have any other questions here live?
I just have a comment to make when you talk about satisfaction without orgasm. I think it's important, as patients, we're the focus of everything. We've got all the caregivers, we've got all this treatment, all this stuff going on, and we tend to forget that our partners are suffering as much as we are, and sometimes even more because they're not actively involved in being fixed, and they can't fix things for us. So I think sometimes just getting out of our own heads and concentrating on satisfying the other person in the relationship is key. I love to tell the story about, my husband and myself when I said to him, I can't do this right now. And he said, well, I notice your mouth still works. So, in other words, I'm here too, remember me. And that was kind of a wake-up call, I think, as a reminder that he needed attention too. Yeah, and I think sometimes we focus too much on ourselves in those situations.
Yeah, absolutely. Again, I think it's about just restoring that intimacy in a relationship, feeling connected, and kind of, again, having needs met within that relationship on both sides, right? And so sometimes it's, maybe, again, you don't have a libido, you don't have any interest in sex, but maybe you're interested in just, connecting with your partner. You want to be there for them. You want to be able to meet their needs. And so, again, so that's why, sometimes, having, being intimate, whether that is sexual intercourse, whether that's oral sex, whether that's just, some other forms of kind of touching and connection, again, I think those are important ways of really kind of nurturing your relationship.
Thank you. Thanks again for doing this.
Absolutely. So, well, thank you everyone for coming. Again, we will have this one archived on our YouTube channel. Generally, it may take, a week or two to kind of get the video kind of processed and placed on YouTube. But if you want to look at any of this again, it will be archived for your viewing. So anyway, thank you for joining us. I appreciate your time. Bye-bye.
Thank you for joining us for our virtual Lunch and Learn series. We hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services classes and events, email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.